Welcome everyone to our presentation for the 2017 benefits. We are going to record this session just so other staff who couldn't attend these meetings are able to get the same information. Joining us this afternoon is Michelle with Holmes Murphy and Annie with Blue Cross Blue Shield. They're going to go over much of the materials for 2017, talk about the new network option through Blue Cross Blue Shield, and also talk about Compass. It's a healthcare concierge service available to all staff. So other than those two primary changes, everything else should be very similar to what you've been used to in the past. So if you have questions along the way, certainly stop us. We can address those as we go. Otherwise, I'm going to let Michelle get started.
Great, thanks Jeremy, and hello everybody, good afternoon. So really quickly, I'm going to open it up with a few comments and remarks, and then I'll hand it off to Annie to walk through a review of the 3 health plans and the new network option that's being made available in 2017. So before we jump in, because we're going to cover a lot of things today, and I know the screen behind me might be hard for some of you to see, but we're going to touch on all of the benefits that you have available to you. However, we're going to spend the most time on the medical plan and the new network option and Compass. And then the rest of it, we're going to just really quickly breeze through because really not much on the rest of it is changing. So before I kick it off to Annie, let me just say a few words about what is in the paperwork that you have in front of you. You should have all gotten a booklet for 2017, and if you didn't, we have extras up here in the front. So this booklet, take it home with you, show it to your spouse if you're married. All of the plans, all of the carrier information, all of the rates for 2017 are in here. In the very first page of the booklet, there is a contact sheet for all of the insurance carriers, who they are, and how you can reach them. So at any point in the year, if you need to find them, you'll know how to be able to locate them. The first thing that's in the booklet is a loose sheet of paper. It's about the open enrollment reminders. The first 2 bullets on there are the most important. It's letting you know when is open enrollment this year. It is the first week of October, Monday the 3rd through Friday the 7th. You should have all gotten an email last week with a link in it to click on to make your appointment to sit down with your benefits counselor. And if you did that, great. And if you haven't done so, we encourage you to do that. There should also be a copy of the slides. So if you want to follow along, you can and take notes. We've given you some pens as well. As we go through and follow along, there's lots of slides, and we're not going to hit all of them because we just don't have time, but we're going to give you all the information anyway in the slides. Then there should be 2 landscape pieces of paper that are black and white. Those are the benefit summaries from Blue Cross and Blue Shield. They look very similar because, as I mentioned, the 3 health plans, the base, the buy-up, and the high deductible plan will be offered again in 2017, and there's no changes when you're going in-network for coverage. So same 3 plans are offered again, the base, the buy-up, the high deductible, and all of the in-network level of coverage is the same. So one of these documents at the very top in the gray bar should say Preferred Care Blue. And Preferred Care Blue is the name of the local Kansas City network that you all are using today. It's called Preferred Care Blue. The other sheet on the top gray bar should say Blue Select Plus. This is the new network that's being offered in addition to Preferred Care Blue. So at the top gray bar, one should say Preferred Care Blue. The other one should say Blue Select Plus. Those are simply names of the local hospital systems here in the Kansas City area. So if you're on the health plan today, and just really quickly, just raise your hand if you're on the health plan today through the district. Most of you are. Okay, great. So the ID card that you carry in your wallet should actually say on the ID card somewhere Preferred Care Blue, because that is the name of the local Kansas City network of doctors and hospitals. When you go outside of Kansas City, the network name changes to Blue Card, and Annie's going to talk a little bit more about the Blue Card network. So the new change, I'm going to emphasize this again, the new change is as a new local Kansas City network option called Blue Select Plus, and that comes with cheaper rates. So when we get to this section in the presentation, the rates are in the booklet, and we'll look at those together and help you understand how those are laid out. Then, for reference sake, we've given you the summaries from Delta Dental and VSP. So the great news on the dental front is there's no changes to the Delta plans at all. The 2 plans through Delta Dental are staying the same. So on the top yellow bar, there should be a B in parentheses. That's for the base plan through Delta. The other line on the other sheet in yellow has an H in parentheses. That stands for the high plan. So one is the base plan, one is the high plan. Those 2 plans are staying the same through Delta. No plan changes and no rate changes. The same is true for VSP. So there's another loose sheet in there, and this is the VSP benefit summary. And that plan is staying the same as well. No plan changes, no rate changes. So again, all the rates that we're talking about today, all the plans, everything is in the booklet. The very last thing I'll mention, and I'll hand it off to Annie, the very last sheets of paper that's in the booklet that's loose is the listing from Blue Cross and Blue Shield of the routine preventive services that you can get every single year for free. So it's a very comprehensive list. You may notice as you're flipping through the booklet that there's another list in the booklet. That one is much more shorter and condensed. This one is a little bit lengthier. So these are all of the routine services you can get every year from Blue Cross for free. So I'm going to turn it off to Annie, and she's going to review the health plans and some other Blue Cross information. And then from time to time, she's going to be focusing on a topic. So I will let you know what page in the booklet that you can see it a little bit better, because sometimes the screens behind us are kind of small. All right?
All right. Thanks, Michelle. All right, thanks for having me out today. Let's take a quick look at the agenda of what we're going to be discussing. I think I'll come over here so you guys can see. We're going to talk about what a qualifying event is, review mybluekc.com website and what that, everything that you can do on there. We're going to talk about added value services. We have rolled out some new products that are super exciting, and I'm going to share those with you. We will take a look at the plan designs, and then we will summarize it all and kind of give you guys some things to think about when trying to decide which plan is the best one for you. Okay? All right, mybluekc.com, that is your member portal, okay? That's where you log in to find out all your information, your explanation of benefits, your claims that are being processed, maybe what your benefits are. It is the #1 place where you will search for in-network providers and hospitals, okay? So when we talk about this new network that we're rolling out that's a much smaller, narrower network, it's super important that you go to mybluekc.com to verify, yes, that doctor is in that network, okay? All right, who here has heard of the Blue Card Network? Anybody? Okay, well, oh, you? Yeah? Okay, good. Okay. So when you are traveling outside of the Kansas City metro area and you need to find an in-network provider, you would be using the Blue Card PPO network, okay? So the Kansas City metro area is Johnson, Wyandotte, and then several counties in Missouri. So that there's 32 counties. But let's say you have a child in Manhattan, okay? They would be using the Blue Card PPO network. That's our national network, okay? And that is the same for every single plan. Okay, so it's not going to be the Kansas City metro ones, it's going to be that national one. And let's say you're traveling to Florida in the summer and you need to find an in-network provider. Blue Card PPO network is where you would find that out. You can look online and you would select Blue Card PPO network on the drop down, or you can call customer service to find an in-network provider. All right, so here we've been talking a lot about this new network that we've been talking, and I'm going to show you kind of a quick overview of it. So today, if you're on the insurance plan, you are enrolled in with the Preferred Care Blue network. It's a much larger network. The only hospitals not included in that network are St. Joe and St. Mary. Okay. In order to save money on premiums for you all, we are rolling out a new network. It's called Blue Select Plus. It's a much narrower network, but still has 9 great hospitals and several thousand providers in it. Olathe Medical's in it, Shawnee Mission's in it, Children's Mercy's in it, So those are some great hospitals still in it. But let's say that you currently go to Overland Park Regional, and that's where you do everything. Well, that is not in this network, okay? So it might not be a good choice for you. You might want to think about just staying where you are today. So I highly recommend, if anybody is thinking about this Blue Select Plus network, they go on the bluekc.com website and they make sure, hey, yes, my doctor's in there, and yes, this is a hospital I use, okay? Here's a list of the 9 hospitals that are within the network, and this is on page 6 of your book. Something I do want to point out about this narrow network. Okay, let's say that you have an emergency. It's life or limb threatening. Okay, and you're not in control of where they take you. So they take you to Overland Park Regional, which is not in network for this network. Okay, for emergent care only, you would pay the in-network price. Okay, the ACA has said regardless of where you are taken in an emergency situation, you will always pay in-network pricing. Okay, once you got stable, then you would move to an actual in-network hospital. So you'd maybe move from Overland Park to Shawnee Mission or to Olathe, okay? But it's nice to know that regardless of which network you choose, in an emergency situation, you would have in-network coverage. All right, so on all the plans, routine preventative services are covered at 100%, okay? That's that flyer that was in the books. It's a lengthy flyer with lots of things. These are going to be things such as your wellness visit, your mammograms, your pap smears, your PSA tests, flu shots, immunizations for your kiddos. Those are all going to be covered at 100% as long as you see an in-network provider. You can have one per calendar year. You do not have to wait 365 days. You can have one in 2016, one in 2017, and it's coded preventative. And that's a key. Make sure you have that discussion with your doctor saying, I'm here for this preventative check. Make sure that it stays preventative and keep it coded preventative. All right, something new that Blue Cross has rolled out is retail telehealth. So it always seems that kiddos or people get sick in the middle of the night or on the weekend, and the last thing you want to do is throw on some clothes and run to the emergency room or run to urgent care center. So we're giving you the ability to have a virtual doctor's visit at your home, okay? It's open 24 hours. You will download an app either on your phone or your iPad or on your computer. You enroll in it. You select the doctor that you want to see. You can do the visit. And if they provide you a prescription, they can then route the prescription for you to go pick up just like you normally would, okay? The great thing about this is it's $39, where your urgent care copay on the traditional plans is $50. So you're gonna save money by doing this kind of visit. This is for some common things such as like pink eye, sinus infections. It's not gonna be for anything too heavy duty. So it's definitely for some of the common things, and this is on page 9, okay? Another thing that Blue Cross has introduced is a tool called RX Savings Solutions. The prices of prescriptions are just skyrocketing, and we feel like it's super important to give our members the ability to save money on those prescriptions, okay? So we're doing it in 2 different ways. One, there's kind of a push way. So if you sign up for emails or alerts, once you fill a prescription, if we have found savings for you, we will then send you an alert that says, hey, we found some savings, and you would log into the website and see where those savings could be. Maybe it's trying a generic. Maybe it's getting it at a different pharmacy. Maybe it's doing Express Scripts. Maybe it's doing a kind of equivalent kind of drug, okay? So that's one way that you can find the savings. The other way is for you to actually go to the website and search hey, I just got this new diagnosis. I have to get this medicine. Where should I get it filled? And it will show you exactly what your costs will be at all of those locations, and maybe give you some other alternatives to save money as well. So this is really going to be a super helpful tool for anybody on the qualified high deductible plan, because on those plans you're paying the retail cost of the medicine, and so those can be quite pricey. So this will be super helpful for you. All right, so this is your open enrollment. Any choices that you make, you will have for the whole year, 12 months. But if you do have a qualifying event, such as a birth, a divorce, you get married, your spouse loses work, loses coverage, you do have 31 days to notify HR of the change and to make a change to your plan. Okay, so you can either add your spouse or remove them or change whichever plan you're on. Okay, if you do have a baby on the way, we do not automatically enroll that baby. Okay, so you have 31 days to let us know, hey, yes, I do want this little one. I do want to have coverage for the little one. All right, any questions on all that so far? If not, we will take a look at the plan design. Okay, so this is the traditional PPO plan. Nothing has changed, okay, on the Preferred Care Blue side, okay? The only change is now we offer this same plan on Blue Select Plus, that narrower network, okay? Let's kind of talk about how this plan works. So let's say you go see a doctor. You have a sinus infection, you go see a doctor. On this plan, you have a $25 copay for your primary care physician, $50 copay for specialists. If you go to urgent care, you have a $50 copay, okay? Let's say you have to have a surgery. And so then you're talking about your deductible. Okay, so on this plan, your deductible, you have to pay, you are responsible for that first $1,000 if you're an individual on here, $300 for the family. Once you've reached your deductible, you then go into cost sharing where Blue Cross pays 70%, you pay 30% until you reach this out-of-pocket maximum down here at the bottom. $4,600 for the individual, $9,200 for the family. So the things that go in that out-of-pocket maximum are those doctor visits, urgent care, if you did retail telehealth, if you pick up a prescription, your deductible, your coinsurance. Those are all feeding into that out-of-pocket maximum. That out-of-pocket maximum is your worst-case scenario or peace of mind number. That is, once you've hit that, you then are covered 100%. And the next time you go to the doctor or fill a script, you will not be paying anything for that. Okay? So on the right side, Blue Select Plus, very similar, okay? Once again, the copays are the same, the deductible is the same. The difference is if you go to the non-network provider, so if you go outside of the Blue Select Plus network, you will be paying more money. Okay, so that's why we keep emphasizing if you choose this network, make sure you see an in-network provider. Because look down here. If you go to see, you have a much bigger out-of-pocket maximum if you are going to see non-network providers. Okay, so that's just something that we kind of want to make sure everyone's aware of. All right, so this is the buy-up plan, same plan design. You have those copays for the doctor visits. You have a copay for urgent care, prescriptions. You have a deductible. The difference between the traditional and the buy-up is in the buy-up, you are paying more money for the premium. So every month you're paying a little bit more out of your check. For when you actually go to the doctor, you pay less. You have a smaller deductible and a lower out-of-pocket maximum, okay? So some people like to know, yes, I'm just going to go ahead. I already get it deducted from my paycheck. I like to just have that done. And then when I actually do have to go see a doctor, I pay less, okay, at that time. So it's just how you would want to do it. Once again, this buy-up plan is offered on Preferred Care Blue and Blue Select Plus. Both networks. Now, just a quick reminder. So we talked about that Blue Card PPO network. That is available on every single plan. Okay, we're just kind of going through the Kansas City metro area networks, but that's available on every plan, and it's the exact same coverage, same kind of thing. All right, so for the traditional and the buy-up, you have a tier system for your prescriptions. So when you go to pick up your prescription, depending on what tier it falls in, is the copay that you will pay. So a tier 1 is going to be your generics. Tier 2 is going to be brand names, and Tier 3 are going to be new drugs on the market. If you're taking a maintenance drug, you can get that prescription through Express Scripts. And by doing that, you just save the convenience of not having to go pick up that prescription at the end of a day, run into CVS to grab it. You can get a 102-day supply sent to your home. All right, so those were the traditional plans. Now we're going to go into the Blue Saver. This is the qualified high deductible plan, and it works quite different than the traditional plans, okay? On the traditional plans, you had copays. You had copays when you went to the doctor. You had copays when you picked up your prescriptions. On this plan, there is absolutely no copays, okay? Every single thing you do will go towards this deductible, this $2,600. And on this plan, once you reach your deductible, you've also reached your out-of-pocket maximum of $2,600, okay? So every time you go to the doctor, every time if you had surgery, every high-tech scan, every prescription, everything you do goes towards that deductible. So let's kind of talk about how this gives some scenarios. So let's say you go see a doctor. You have that sinus infection. You go see a doctor. The doctor normally charges $140. Well, because you saw an in-network doctor, we have a negotiated rate with them that says, hey, you can only charge $65. So when you go to the doctor, you do not pay anything at the time of the visit. You're not paying anything up front. Once you've gone to the doctor and they've sent you the bill, wait for that explanation of benefits to come, because the explanation of benefits from Blue Cross says, this is what they charge, this is the allowable amount, this is actually what you owe that doctor's office, okay? And then you would pay the doctor that amount. And that goes into the deductible. Prescriptions, these are also different, okay? So a prescription on the traditional plans, you were paying a copay. So you knew that you were paying, $40 for Tier 2 medicine. On this plan, you are actually paying a discounted retail cost of that prescription. So if anybody is considering being on this plan and is on a lot of prescriptions, I highly recommend going to our website or going to goodrx.com or just trying to figure out what that retail cost is, because if you're used to paying a copay, you may end up and probably will end up paying more if you switch to this plan, okay, for that medicine. The great thing about this plan is it has the lowest out-of-pocket maximum, okay? So that's kind of the nice thing on this plan. So these plans, the qualified high deductible plans, are usually really great for people that are super healthy, that never see a doctor, and they can do the health savings account, and the districts, if you're an individual, they're going to put money into your account, which is a great thing. Or if you're super sick, you're on you have a surgery coming up, okay, in February, and you know you're going to hit that out-of-pocket maximum regardless. This has the lowest out-of-pocket maximum. So it would make sense to maybe think about this plan, because then you would hit it in February, and then the rest of the year you'd be covered, okay? So those are some scenarios of why people would want to do this. Let's talk about the health savings account. So we just talked about the banking piece. The government is allowing you to open up a health savings account because you are on that qualified high deductible plan. This is an account that is owned by you. You manage the account. It's just like a checking account, okay? You put the money in, you determine how much money you want to put in. You can determine when, like every month you can change. I want to put $100 in this month, $100 next month. Okay, it's Christmas time. I don't want to put anything in. Okay, it's very flexible in that way. You also own the account. So if you were to leave the district, retire, switch back to a traditional plan, you still own those accounts. There is no use it or lose it in this account. So let's say you have a super healthy year, you have all this money in it, that money just rolls over. Okay, that money is yours. And then you also have a triple tax savings for this account. So you can put the money in without paying taxes on, as it can grow in the account without paying taxes. You do not pay taxes on those earnings. And then if you spend it on qualified items, then you also do not pay taxes on it. So it's kind of a triple tax savings. So to be able to open this account, you have to be on that qualified high deductible, and you cannot be on your spouse's PPO or HMO plan. You can't have Medicare or Medicaid. You can't have TRICARE. You can't have one of those flexible spending accounts. So if you currently have one, you'd need to zero that guy out before this is opened, okay? The one thing you can have is the daycare flex spending account. You can have that and the health spending account. All right, so in 2017, you can contribute $3,400 for an individual, $6,750 for a family. If you are an individual on the health plan, the district is putting money in that health savings account for you. So this would be a total amount. So you would need to subtract out the amount the district is putting in, and then you could put in the remainder amount if you wanted to max out the account. Okay, so you have all this money in there. What can you use it on? Well, you can use it every time you go see the doctor. You can use it for prescriptions. You can use it for eyeglasses, going to the dentist, getting braces, all those kinds of good things. Long, long list. IRS publication 502. The coolest thing I think on this plan is if you are an individual on the plan and you have this money in this health savings account, you do have the ability to use that money for your spouse and dependents, even if they're not on the insurance plan. All right, so here are your responsibilities. The government has laid these out. This is between you and the government, not between you and Blue Cross or you and the district. Basically, you need to meet those eligibility requirements we talked about, contribute to the max, use for those qualified expenses, and save your receipts because they have 7 years to audit you. All right, so much information, okay? So I'm just going to summarize real quick, in trying to think about what works best for my family, okay? The first thing I would do, because we have this new network, and we have 3 plans on the old network, 3 plans on the new network, I would say which network fits for me, okay? Do I already use Olathe Medical Center? Are all my doctors there? Are all my doctors in this network? Well, if so, maybe I want to do that network because I save money on my premium. Okay, so that might be a good fit. Or, you know what, I do everything at St. Luke's. It's not going to work for me. So then I need to just stay with Preferred Care Blue. Okay, so that would be the number one thing that I would think about. Once I've done that, then I would decide, hey, which plan works for me better? Do I like a copay structure? Do I like to know when I go get that prescription, I pay a copay? Okay, or maybe the health savings account. Maybe the qualified high deductible plan would be a good one. I'm really healthy. I'm the only one on here. I never go see a doctor. So why not have that money fed in from the district? I can add some money, save some money on some taxes, and that can just keep growing. Or like I said, hey, I have a surgery coming up. I'm going to max out super quick. So then I would be covered the rest of the year. Okay, so those are just some things that you need to think about when trying to decide what plan would be right for you. So I will be around afterwards for questions, and I'm going to hand it back over to Michelle.
Thank you. Okay, so let's get into the information that talks about the cost for the health plans for next year. So if you would turn to your booklets, it might be easier for you to see in what you have there in front of you on pages 12 and 13, because this slide may be hard for a few of you in the back to see. Page 12 shows the rates that take effect on January 1st for the Preferred Care Blue plan. So And again, Preferred Care Blue is the network you're already using today in 2016. So if you choose either the base, the buy-up, or the high deductible, and you choose to stay in the Preferred Care Blue network for local Kansas City coverage, these would be your rates for 2017. The first column you see is the monthly premium. That is the cost that Blue Cross will be billing the district in 2017. Those rates are going up 5.5%. So that means the increase that the district received from Blue Cross for 2017 is 5.5%. While that seems pretty good, you should know that regular medical inflation here in the Kansas City area is about 8 to 9%. So any given year, on average, 8 to 9% is the actual rate of medical inflation. So most of the school districts and most of the employers in town wish they had a rate of 5.5% because they're actually getting 2 and 3 times that for their increase. So what that means and what that tells us is that you all utilized the plan very well this past year. So that's great. So that's the first column of rates. It says monthly premium. In the middle column is what the district is contributing to the cost of the plans and the coverage. So $439 all the way down through all of the tiers and all the 3 plans is what the district is contributing to the cost of coverage in 2017. Then that far right column shows employee costs. So that would be your true out-of-pocket cost on a monthly basis if you were to select any of those 3 plans, the base, the buy-up, or the high deductible. So I'll draw your attention to the high deductible box at the bottom. You see a red dollar amount, the $78. That's a credit because what the district is providing dollar-wise, the $439, is more than the actual cost of the monthly premium. So the credit of the $78 would go into your HSA every month when you're enrolled for that level of coverage in that plan. So if you're taking employee-only coverage on that high deductible plan, that means the district is going to put that money over the course of 12 months, about $936 into your HSA. So you, of course, are also encouraged to put money in there as well, but that's a good chunk of change that's going into your HSA. Okay, if you look at the next page, page 13, those are the rates for the new network, the Blue Select Plus network. So if you're considering this, you'll notice same contribution from the district, the $439. The premium rates are less. So those 9 hospitals and the providers that are in that network have agreed to deeper discounts, and thus the premiums are less as well. So you can see in the far right-hand column what your monthly cost would be should you choose one of those 3 plans, the base, the buy-up, or high deductible. And I'll draw your attention too to that line in red with the credit. So if you take employee-only coverage on the high deductible plan again, and you choose the Blue Select Plus network, you're going to get even more money into your HSA, $105 per month. So over the course of a year, it's a little over $1,200 that's going into your HSA. So quite a bit of money is going in there. And we'll stress it again, if you're considering the Blue Select Plus, please go to the website, which is bluekc.com. In the top right-hand corner, you can click on Find a Doctor, type in your doctor's name, type in your zip code, and in the drop-down box, you'll have several options to choose from. You'll see Blue Card, you'll see Preferred Care Blue, you'll see Blue Select, you'll see Blue Select Plus. They have many networks that Blue Cross offers, and there's about 5 or 6 in that drop-down menu. You want to choose Blue Select Plus and see if your doctor is in the network, because the last thing we want to do is get you all excited leaving here today, and you're telling your family, we're going to do Blue Select Plus because Annie and Michelle said it was the way to go. Make sure you do your homework and see if your doctor and hospital and facilities are in that new Blue Select Plus network. Just make sure they're in there. Okay? Okay, we're going to switch gears to Compass and say a few things, and then we'll kind of wrap it up. So any questions about the health plans, the 3 options, the new network option? Everybody's good? Okay. So Compass is actually already available to you today, and there's a flyer in your booklet as well, and their phone number and their website is in there also. So Compass is your patient advocate, your healthcare concierge. It's been available since the beginning of the year, and if you want to start using them tomorrow, you can. This is being offered to you at no cost because the district wants to provide an extra layer of service to you. So if you're ever in a situation where you need help finding an in-network specialist, in-network hospital, maybe you're on the road traveling for vacation and you just need some extra help, you can call Compass and they can help you find in-network specialists, in-network providers. It's also great if you're on the high deductible plan and you want to use your HSA money or spend your money wisely, because if you contact Compass ahead of time and tell them what you're needing, they can tell you what the cost of the service will be before you go in. So I'm going to give you an example. Let's say that your doctor wants you to get an expensive lab or x-ray or a surgery, or you're pregnant and you want to know what's it going to cost me to have my baby at Olathe versus Shining Mission Medical Center. You can call Compass ahead of time and they will tell you before you go in what it's going to cost you, because labs and x-rays and pharmacy costs and surgeries will vary greatly from provider to provider, from hospital to hospital. They're not the same at every single facility. And then, should you get a bill in the mail that you think is wrong, that your doctor didn't charge it right, they did something wrong with the coding of the claim, something's not right, and you don't want to take the time to call back and take time off of work or on your break to make multiple phone calls to the carrier, to the providers, to the facility, give that to Compass. That's what they're there for. You can send it to Compass, email it to your health pro. They will take that work off your plate. They will ask you to sign an authorization form to talk to your doctor's office or to talk to Blue Cross, but they'll email you the form, you sign it, you send it back to them, and then they're going to start helping you resolve your issues. Okay, it's a very handy program. So what we're going to do next is we have a 1-minute video that talks about Compass. It's just 1 minute, so we really want to make sure you totally get the whole concept.
Meet Sam and his friend Janine, his Compass Health Pro, to show you just what this service can do for you. With your health plan, you want to be an informed consumer. Just like shopping for anything else, you want to compare apples to apples and dollars to dollars. Janine, the Compass Health Pro, helps Sam sort through it all. When Sam's doctor suggests he get an MRI for his tennis elbow, Sam calls Janine for advice. She gives him a written summary of his options, testing locations near his office and home, complete with costs, so Sam can decide where he wants to go. Sam is surprised to learn that the same MRI could cost anywhere from $400 at one facility to $2,500 at another, and they're just a few miles apart. Still, Sam isn't sure. He didn't understand one of his doctor's instructions. So guess what? Janine calls the doctor's office for clarification, just to make sure Sam's getting the right test and the right care. She even offers to help make the appointment after Sam decides where he'd like to go. Wow. Sam says he'd rather drive a little further for the $400 test than pay $2,500, so Janine makes the appointment and Sam's on his way. When the bill comes, though, Sam doesn't understand some of the codes. Does he call the facility billing office? Nope. He calls Janine, who's available Monday through Friday from 8 a.m. to 6 p.m. Central Standard Time. She explains exactly what the bill means and can even help get it fixed if there's a mistake. Janine takes a load off Sam's mind and keeps more cash in his wallet, which makes Sam very happy.
Okay, great. So again, that's Compass. It's already available. You can start using them today when you leave the building. It's free to you. The district is paying for it, so you will not be charged for this service. All right, so the rest of this, we're going to pretty much fly through because we want to get you out of here on time, and there's really no changes. So I'm just going to breeze through these slides, so kind of hope it doesn't make you dizzy here. So with dental, nothing's changing. The two plans, the base and the buy it plan or the high plan, are staying with Delta. Same network, same plan coverage, same rates. No changes whatsoever to the dental plan. Same story with the vision. Same carrier, VSP, same coverage, same plan design. Same savings and discounts, same rates. I will draw your attention to number 4 here at the bottom. VSP does not provide ID cards. You do not have to carry a VSP card in your wallet or purse. And everything runs through your name and your social security number. So if you're covering your spouse and kids and your spouse wants to help you out and make all the eye appointments for the family, make sure when they're calling in and they ask, what's your insurance? Who's it through? They give them your name and your social, because if your spouse gives them their name and their social, VSP will never be able to find them in the system because everything runs through you. Same rates, as I mentioned, no change. Okay, the flexible spending accounts will be offered again in 2017, sometimes known as the FSA, not to be confused with the HSA, and the insurance world loves acronyms. So this is the FSA, this flexible spending accounts. If you're on the traditional plans today, you may already have one of these. You may have the medical FSA, where you can set aside pre-tax money into an account to offset your co-pays, your co-insurance, your costs for your deductible, maybe your pharmacy costs or your dental costs or vision costs. That's being offered again. So the medical FSA will start again in 2017. You can set aside, the max is $2,550 per year. And again, you can use that money for your family's co-pays, medical expenses, pharmacy expenses, vision and dental expenses, even if you don't cover them here. These plans are use it or lose it. So the IRS says if you set aside $1,000 for 2017, you need to spend it down by the end of the year, or the IRS says you will lose the money. The second FSA account is the daycare account. If you've got little kids who are in daycare or preschool, they're under the age of 13 and they're in care during the day while you're working and your spouse is working, the IRS says you can set aside $5,000 per household to offset those costs. So again, these two plans are use it or lose it. You must spend the money by the end of the year. They're great tax-saving vehicles. So if you have these expenses throughout the year, we strongly encourage you to consider the plans. The administrator is Flex Made Easy. They were the administrator this year as well, so they're staying in place. If you had a debit card in 2016, you'll keep the debit card. They'll just reload it again for 2017 with your new election. The annual compliance notices are in the back of the booklet. You can read them later, but all of these notices every year you have to get by law. They talk about Medicaid, the Children's Health Insurance Program, Medicare, the Marketplace Exchange for Obamacare, the Medicare Part D notice, special enrollment rights, women's health care and cancer rights, COBRA, the privacy notice, and the SBC. All those are in the back of your booklet, so you can look at those when you have time. So when you got the email last week notifying you it's open enrollment time and it's time to make your appointment with the benefits counselor, those counselors are with Benefits Direct. So when you sit down with them, they're going to be talking about other types of voluntary insurance products that you may be interested in. You may have enrolled in these last year and you can keep them for next year at the same rate. So there's no changes to the plans or rates. They'll talk to you about certain types of insurance. The first one will be voluntary life insurance. So if you want to buy voluntary life on yourself, your spouse, your kids, you can. When you were first offered the coverage last year, the guaranteed issue was $200,000. That's for the first offering only. If you want to increase it for 2017, you can increase it another $50,000 with no health questions, as long as you stay below the guaranteed limit of $200,000. So let's just say you took $100,000 last year, you could go up another $50,000 with no health questions. They'll also talk to you about short-term disability insurance. And again, if you took this for 2017, you can keep it for 2017 at the same rates. If you're going to take it for the first time, I always caution people about the pre-existing condition limitation of 312. That number of 312 just means when you buy the policy for the very first time and you had a condition 3 months prior to the policy activating, you cannot file a claim for that particular condition you already had 3 months prior to starting the policy. So I'll give you an example. Last year in the fall, when one of your male counterparts, they purchased this policy, they had already been diagnosed with a knee problem. In early 2016, he needed to have knee surgery. He filed a claim, and of course it was pre-existing. They will look at your medical records and determine that, and they denied that claim. Now, had he had anything else happen to him, that would have been covered. But since he had a pre-existing condition 3 months prior to buying the policy, it was denied. Now, once you've had the policy for a year, I mean, everything is fair game and there's no more pre-existing condition limitations. This benefit will pay out for 6 months for injuries or accidents or maternity. For 6 months, they'll pay a portion of your paycheck. Why 6 months? Because after 6 months, if you're still disabled and can't work, then your CAPERS LTD benefit kicks in. They'll talk to you about cancer insurance and whether or not that may be a good fit for you. as well as accident insurance, critical illness insurance, long-term care, and permanent life insurance. So those are what they call voluntary products. And so they'll offer you and introduce those to you and see if you have any questions. Here is a view of the link that you would have gotten in the email last week to make your appointment to sit down with a benefits counselor that first week of October. You can always call Benefits Direct as well. Their website and phone number is in the booklet in the front there if you have questions afterwards. And here is the schedule for that first week of October. And they'll be here on Friday, October the 7th. If that date does not work for you, you can certainly go to the other locations and times as well. So we have reached the end, and we'll be around for questions afterwards. So we thank you for being here today and hope you have a great evening. Thanks.